Okay, good morning, everyone. So we have Carissa McGuffin, our dental coordinator here. She will be giving us dental updates on what's happening now with dental services, how our consumers will be able to access that, and what else we could do to help and support our consumers. Tony is also here with us, joining us. So Tony, would you like to say anything?
Oh, well, anytime you give me a chance to talk. I just
My mistake.
want to thank Carissa for being here. You know, when I first started, one of the big things that several people came up to me and said, we have a serious problem in the area of dental services. And so we did quite a bit of work, and a lot of you gave some great input, and we eventually got some grants and got funding for the dental coordinator, and we're going to have the dental coordinator all the time now. We're going to keep that going because it's a very important service, and we've got some other projects in the pipeline as well related to improving oral health. So, but I wanted to at least periodically check in with Carissa and talk about what's up, what's happening, and give everybody sort of opportunities to ask those questions when you can. And I know not everybody's using the dental coordinator, and so we want to make sure that everybody understands what's out there for all of us, so that we can help our consumers. So thank you, all of you, almost 40 people, for being on the on this Zoom webinar today.
Thank you, Tony. And for our participants, so there is a chat button available. I'm going to monitor that. If you have any questions, please feel free to use that. There's also a setup Q&A button there. If you wanted to use that, if you have questions, you may use that as well. I will monitor both the Q&A and the chat portion of our webinar. And then, as we've said, this is recorded. The link, when it's done, I will post it on Inside Exchange, and I plan on sending it also as an email similar to the invitation for those who weren't able to attend, and if you guys wanted to refer it back to it at a later date. Okay, so I will give the floor to Carissa.
All right, thank you, Tony and Claire. It's good to meet with you guys, even though it's not in person. I'm just really excited to share what we're doing and some of the changes that have happened over the last 4 months, and just kind of what's to come for the dental portion of VMRC. And I just have to say in advance, I'm really sorry if there's any noise or interruptions. I've locked myself away in the office, but I can't always get away from the kids and the dogs and everybody. So hopefully nothing happens like that. Before we kind of get started, I want to talk a little bit about why I think dental is so important, why I do what I do, why I chose the career that I chose, why I'm so passionate, all of that stuff. And if any of you guys were at the Stockton adults meeting right before shutdown, right before we started quarantine, I gave a similar presentation to this. So I'm sorry if you've already heard this, but it's good to review because I'm just so passionate about it. I just want you guys to understand why oral health is so important. Our mouth is the entryway to the rest of our body, and that includes our digestive tract and our respiratory tract. So our whole body's connected, even though we often like to separate the medical side from the dental side. Our mouth and our head are connected to the rest of our body. Our mouth is filled with so many different types of bacteria. Most of that bacteria is good, it's important, A lot of it is harmless bacteria, but some of that bacteria that ends up in our mouth, certain strains of that bacteria can really negatively impact the rest of our body. And so some of the problems that can come from poor dental health, that includes strokes, heart disease, lung conditions, diabetes, and then of course we know stuff that is involved in our mouth, like gum disease. We can lose teeth, bad breath, of course, and cavities and dental decay. And one of the things that's not listed in this little infographic is Alzheimer's. There's a lot of research to show that the bacteria that starts in our mouth can travel to our brain and cause or make worse Alzheimer's. And so that's just a little overview. There's so much more to that, but just kind of a little preview of why it's so important. So the last 4 months, as we all know, have been a little bit crazy, a little different than what we're used to. And dental has been no exception. In the initial state shutdown, all dental offices were also shut down. A lot of you guys probably noticed that if you guys emailed me or tried to use our services. So there was a good couple months where most dental offices were closed. A lot of them stayed open for true dental emergencies. They were only seeing maybe 1 or 2 patients a day. A lot of them were shut down completely. So that definitely negatively affected what I do on a daily basis and getting our consumers help that they need. But the good news is that a lot of the general dental offices, pretty much everyone that I know of, is now open again. Using certain precautions. Things have not gone back to what we would consider normal, but they are open and they are seeing patients. And then what a lot of you guys have definitely probably noticed is that our sedation services, Barnes Dental Surgery Center and Dr. Begow were pretty much closed completely. Barnes was 100% closed, not seeing patients, not even working on getting patients scheduled, anything like that. And then Dr. Begow was able to kind of squeak by and see a true emergency patient here or there, but for the most part, they were also closed. Good news is both of them are back up and running. Barnes Dental reopened Friday, so less than a week ago. So I would just like to, thank you guys for your patience during this time, and especially continued patience as we are reopened. We are doing services, but as you can imagine now, all those offices are 4 months backlogged. I'm more than 4 months backlogged of getting consumers through. So if you have sent me a referral in the last few months, I am working on that. I will be getting in touch with you soon. The beginning of this week has been really busy, which has been actually very exciting. So it means that we're getting back on track. All right, and something I do want to just point out really quickly, this is for at all times, but just in case we go through another state shutdown as things are kind of uncertain right now, I just want to touch on dental emergencies, especially if dental offices are closed again. I just want to point out, if there is a life-threatening dental emergency, have the caregiver, have the family call 911 or seek urgent medical care. I feel like that's kind of common sense, but just remember that if dental offices are open and available, make sure that consumer gets scheduled with a dentist ASAP. And if we are in a time again where the dentist offices are not open or readily available, they can go to their medical provider or urgent care, or at the absolute last resort, the emergency room. The dentist or the doctor can prescribe an antibiotic if there's an infection causing the consumer any pain. That will help the infection go down, and then they can prescribe some form of acetaminophen and ibuprofen to rotate and take for pain as well. assuming that the consumer can tolerate those medications, of course. All right, and then so I just want to kind of go over the policies that we're going to have in place for now. Claire can also kind of speak to this a little bit if she has anything to add to this. Of course, the policies are going to depend on what type of location. Is it a surgery center? Is it a hospital? Is it a general dentist? And a lot of the policies are rapidly changing. Every time I talk to an office, a surgery center, the rules have kind of changed as the research changes a little bit. But of course, at these appointments, at all possible, social distance from people. When you're at the dentist, you know you're not going to be able to social distance while they're working on you, but use discretion and social distance as much as possible. And same with wearing a mask. Wear a mask whenever it's possible. A lot of offices and surgery centers are just that's gonna be a requirement anyways. And then one thing, if the consumer's at a care home, I think ideally DDS wanted there to be a 2-week quarantine after any medical or dental appointments, but that's not always possible. And so at the very least, the consumer must change their clothes, shower, and then launder those clothes as soon as possible after that appointment.
Yes, Teresa, that's true. So with that, we have been more with the reopening that has happened. We've been, if it's a regular dental checkup or a doctor's office, since it's a more controlled environment, as long as the consumers will be able to wear masks at all times and practice physical distancing, and then shower and change clothes when they come home, then we are not requiring them to do the 14-day isolation. And the reason being, in those areas, they have a controlled atmosphere wherein their chairs are really physically distanced. And then most people are wearing masks because they are required. And so there's more of that protection for our consumer and less possibility of any type of exposure.
Right, thank you. And then I have just some policies that I got from Barnes Dental and Dr. Begau. Of course, like I just said, they change often. Every time I talk to Dr. Begau, things have changed a little bit because they work with different hospitals and surgery centers. But the latest that I heard from Barnes Dental is that they recommend the consumers have a COVID test done prior. But it is not required to have a COVID test. But if there's no COVID test, there is going to have to be a written explanation of why they didn't take one, which for consumers, for the most part, this is fairly easy. If you can just explain that due to behaviors or lack of understanding, then that will be, that should be sufficient. They did tell me that there can only be one caregiver per consumer right now. And then both the consumer and any caregiver that comes in will have a temperature screening as well as kind of like a questionnaire before they go into the surgery center. And then with Dr. Begau, like I said, it definitely depends on where the surgery is taking place because they work with so many surgery centers and hospitals. For our consumers, they're typically seen at a Sutter location, and Sutter locations require there to be at least an attempt at a COVID test. Sutter is going to arrange the test with a caregiver. From what I understand, there was 15 locations that this test could be taken at, and it includes Modesto and Stockton. So at least for the consumers at the Modesto and Stockton office, there should be something fairly close. I'm not exactly sure where the closest would be for the consumers up in the mountain counties though. I do know that the Sacramento location does have a drive-through, but I'm not sure about the other locations. And then this attempt must be done 3 days prior to surgery. If for whatever reason the testing is unsuccessful, if the consumer will not let them touch them, etc., there will be arrangements made. So they can still have their surgery done, but there may be different precautions that take place, like the surgery may take place in the afternoon instead of the morning. They'll arrange a longer time in between patients so that extra precautions can be made. And then the surgeon and everyone working in the actual OR room will wear extra protection as well. All right, and then I just want to touch on our general anesthesia referral, answer any questions. I feel like this always brings up more questions the more that we talk about it. I do want to make clear that as of right now, it's not required for you to send me a referral. It's not required to go through me to take care of a consumer getting general anesthesia. It is more just a option for you guys as a convenience. Some of the people that I would consider that don't necessarily need to use my services, children, for the most part, if you take your child to the dentist and they need to have sedation or general anesthesia, the pediatric dentists and those who work with children are pretty familiar with the referral system. They are familiar with the surgery centers that we have available. We have surgery centers within our counties that do sedation for children. So the process is typically a little bit easier. Medi-Cal and dental insurances cover that. And so out of all the referrals that I've received, I've only received one for a child, and that was kind of a special case. Another reason that you wouldn't have to go through me is if the family or the caregiver is confident and able to do it themselves, they've worked with a surgery center, they've worked with a dentist, their personal family dentist can give them a great referral, they can go through that themselves. That's perfectly fine. The only thing is with specifically Dr. Begau, they like to have one point person if there's any confusion or anything and it's a new patient. So they may refer the family back to me. And then in that case, I will help them with it just because they like to keep it a little bit more organized sometimes. But if the caregiver, is really confident, they know how to do it, it's pretty simple, especially with surgery centers and hospitals that we do not vendorize with. I don't have any connection with them. I don't talk to them on a regular basis. So the family or caregiver may have just as much success as I would. And then another person that could take care of the general anesthesia themselves would be someone who has already had sedation. We do have consumers who go see Dr. Begau or Dr. Barnes on kind of a every 18 months to 3 years rotation. The family or the caregiver is used to that. The consumer, is kind of on a routine. They know what to do. Then the family caregiver, they can take care of that themselves as well because they're not really looking for a place to go. That being said, if there are any questions or you guys as the service coordinators or the family or caregivers are having questions or problems, you can absolutely reach out to me at any time. I do ask though that if you do send me a referral, please send me as much information as possible because the more information that I receive from you guys, the less questions I have to ask, the less paperwork I have to ask for. And so basically the less I'll have to harass you. So when you do send a referral, send the dental coordinator referral that's found in the P drive under dental coordinator resources. Send me the consumer's Medi-Cal cards. That would include the Medi-Cal managed health plan as well as their benefit identification card. So both of those because they use the health plan for the sedation. If the consumer has a referral from a dentist or their PCP, please send that with it. And then any x-rays or treatment planned from the dentist. So some of our consumers, they are able to go see a general dentist, and they may have x-rays and a checkup done. But then when it comes to doing treatment like a crown or a root canal, the patient's not going to allow that. So then they have to be referred out. So in that case, make sure you send me the x-rays, treatment plans, etc. And then a lot of surgery centers are going to require some form of ID or a photo. We realize that a lot of the consumers don't have a state ID. So a photo of them attached to our VMRC letterhead will typically take care of that. I've heard of some sedation offices will allow the parents' photo IDs if they live with their family, stuff like that. So some of the requirements can be tweaked a little bit, but send me some type of ID or a photo that I can work with. And then one more thing to keep in mind is that I do not put any POS information in. I'm not able to, I don't approve those. So that again will kind of fall on the service coordinator and the program manager, like it does for other services. And then the rule that kind of freaks everybody out. So almost all surgery centers, hospitals, insurance companies are going to require a referral from a general dentist or a physician. This isn't something that I made up. It's not something that even like Dr. Bagau's office made up. It's typically the insurance is not going to pay for it unless it is unless they know for sure that it is needed. So if a consumer cannot see a general dentist, that is fine, but we will still need to get a referral from their doctor. The family can do that. I can help facilitate that, get that paperwork, but we do have to have a referral from somebody that's not us. And the exception to that is that if you are seeing Barnes Dental, they have a general dentist attached to their surgery center. And if the family or the caregiver and the consumer are willing to go down there 2 times to Visalia, the first time they'll go for an assessment, and then the second time will be surgery. So in that case, basically that dentist is making the referral for them. All right, and then I want to touch a little bit on the types of anesthesia, just because I think that this can be a little bit confusing. I don't claim to be the expert on this. I don't work a lot with anesthesia because I'm not a dentist, but I've worked with some of these as a hygienist. And just kind of to run through them a little bit. Local anesthesia, basically what that means is a shot inside of the mouth. So if you've gone to the general dentist for a small cavity or a root canal, they probably gave you a shot of lidocaine into that area. So it just numbs up that area that they do the shot in your mouth. You don't lose any type of consciousness, doesn't affect your brain. Sometimes your heart will speed up because it uses epinephrine sometimes. But you're able to, it wears off, within a couple hours, and you're able to leave the appointment just fine. The next one is nitrous oxide, which a lot of people refer to that as the laughing gas or the gas that makes you feel funny. That helps calm you down. It can help you not feel pain as much. It does not help, you don't lose consciousness. Once you're taken off the nitrous oxide, you'll be pumped with just oxygen. And then at that point, you would be able to drive home or be able to walk out of the appointment yourself. And then the next one is called conscious sedation or oral conscious sedation. And that is typically either a pill or a liquid that you would drink that makes you feel kind of funny. It helps you not feel pain as much. You may go kind of in and out of consciousness, and you may not remember parts of the procedure. You may laugh, it may make you more angry. It's a very light type of sedation. This is fairly common. I don't know if it's as common anymore, but in pediatric offices for children who are a little nervous about seeing the dentist, they'll use this medication. The next form is IV sedation, where basically they will insert a shot into your arm or to your leg, into the muscles, or it can be, an IV, put in through an IV, and it's just medication that helps you relax. Sometimes you'll hear it referred to as twilight sedation. You go in and out of consciousness. There is some recovery time, but it's not as long as general anesthesia recovery time. But typically you're able to breathe on your own with IV sedation. And then the last one is general anesthesia. This is typically done in and going back to IV sedation real quick, that can be done in a dental office. So you'll hear of offices who, put you to sleep. That's typically what they're talking about. And then general anesthesia, that's the strongest form of anesthesia. It's done in a surgery center or a hospital typically. You have complete loss of consciousness. It has a little bit longer of a recovery time. And typically you don't remember the procedure at all. And then this is done either through inhalation with a mask or through IV in your arm. And typically you have to have someone breathe for you. So the anesthesiologist is going to, insert a throat pack and breathe for you, basically. Again, I'm not the expert. I don't do general anesthesia, not a dentist or an anesthesiologist, so I don't really know the mechanics of that. But that's typically what, if you're referring a patient to me for anesthesia, that's what they're getting, which is the same thing as when you go have a surgery on your knee or whatever. All right, and then one thing that you'll probably hear me talk about if you have a conversation with me and we're trying to figure out how to get consumer dental services is RDHAP, which basically that stands for Registered Dental Hygienist in Alternative Practice. And basically this is a dental hygienist who has done extra schooling to be able to provide dental hygiene care to those with limited access to traditional dental care. So an RDHAP, they're able to start their own practice. I know a few that have their own dental hygiene office, and they can also take their practice on the road. They can have a mobile practice that goes into care homes, into residential facilities, nursing homes, schools, etc., anything really. And the services that an RDHAP can provide are oral cancer screenings. They can do dental cleanings. They can do periodontal therapy, which that just means deep cleanings. They're able to do sealants, fluoride varnish. They can do nutritional counseling, as well as oral health education. They are not able to provide local anesthesia, which, like we just talked about, is the shots, but they can provide other types of numbing gel and stuff like that. All right, and then we'll just touch on a few things kind of for what's going on right now in the future. So beginning of this year, we rolled out a dental screening clinic, which the first round of those I felt like were really successful, really set the ground, laid the groundwork for what will come. I was really excited about it, but unfortunately right now, since we're not doing anything in person, that's the dental screening clinic is just basically on hold for now. Yeah, which makes me really, really sad, but it's just important to keep us all safe right now. And I will let everyone know when we're able to do that again. And then same thing with the virtual dental home. Right now, there's no update to it. Everything's just on hold. And I will, of course, keep everyone updated on that as well when we're able to move forward eventually. All right, and I do quarterly classes for providers. So the providers who work in care homes or in day programs, they're able to come to my dental classes and receive CE units. For now, probably for the next little bit, we will be doing those via Zoom. And my next class, so if you speak to any providers, day program providers, residential facilities, you can invite them to our next class, which is August 19th from 9 to 10, and it's going to be on managing tooth sensitivity. I think that's everything on that. And oh, you can sign up on the website. And then the best place to find a resource, if you are just looking for, who in Stockton or who in Tracy accepts Medi-Cal, lists like that are going to be found on the P Drive under Dental Coordinator Resources. There is some information that's also where you're going to find the referral for me. I have a lot of instructions on there. So if you kind of forget what we talked about today, a lot of those instructions are like what to send me in the referral are in the P Drive under Dental Coordinator Resources. And then if none of that answers your question, feel free to contact me. Basically, you can find me under Dental Coordinator on all the VMRC directories, not under my name. And then you can see on here my email address, dcoordinator@vmrc.net. And then I do like to just point out that I'm not a full-time employee. I am funded through a grant part-time. And right now this doesn't apply, but when we are in office, when we are able to meet together, I split my time in between the offices as much as possible. So it's not like you'll always find me sitting at a specific desk or a specific area. All right, and that's pretty much all the information I have. So if you guys have any questions, I think, Claire, are you going to read? Okay. Are you going to read them off the chat, Claire?
Yeah, so far I don't have any new questions. I do want to emphasize the dental classes. It is on our website on the calendar of events at vmrc.net. And if staff is interested in attending, you may attend that as well. You can register there. Registration will go to Lorraine, and then she will, and then it's like it's set up as a webinar similar to this. So if you register, you will receive your registration email as well, and information on how to access the webinar. We are planning on posting the previous webinars as well in what do you call that? In our website. So that's something we're in the process of doing. I do have a question here now. Marlene has a question. Regular cleaning versus deep cleaning.
Oh, I like this question. So basically we can think about that as broken up into regular cleaning equals healthy patient, deep cleaning equals non-healthy patient. And so your dentist and hygienist will take an assessment of your mouth based on if there's any bone loss, if there's a lot of plaque, if the gums are very puffy and inflamed, and if you have bleeding. And so based on those things, they'll either classify you as healthy or unhealthy, which of course there's more professional guidelines and things like that, but you guys don't need to worry about that. But a regular cleaning is what you would typically go to your office for. They don't need to numb you up. They just clean about 1 millimeter to 2 underneath the gums, polish your teeth, and you're good to go. Your gums are healthy. The deep cleaning is typically someone will need to get numb for. They go deeper underneath the gums up to, up to about 10 millimeters, which is really deep. And they'll clean out any soft plaque or that hard tartar buildup that gets underneath your gums. It's definitely considered a more invasive procedure.
Thank you for clarifying that, Carissa. Here's another question. Medi-Cal doesn't cover deep cleaning, which most cannot afford.
Right now, I know that the Medi-Cal requirements and what they cover changes a lot, but as far as I know, right now they do cover them. I believe it's every 24 months. As long as the patient qualifies for it. If you have a specific consumer that's having a problem with that, please contact me. Especially because our consumers are a DDS consumer, they have some special privileges when it comes to dental.
That's good to know. Marlene said, thank you so much.
Thanks, Marlene, for the question.
Any other questions from our participants, attendees? Here's another one from Annabelle. Where can I find a list of insurances that are covered?
Can I have a little bit more clarification on the question? Insurances that are covered by what?
I'll try to allow talk so Annabelle can. There, Annabelle, I have unmuted you. You can. Oh well, I guess I allowed talking, but I have to unmute you so you can. There.
Can you hear me now?
Yep.
Hi. Yes, I can hear you.
Hi. I was trying to type my question very quickly. There is an insurance company that I can't think of the name at the moment. I'm trying to Google, but I've heard it being brought up. And like I said, I can't think of it. So I don't know if there's different names like Guardian or that are classified under Medi-Cal, or what is the traditional Medi-Cal insurances, I guess.
Right. So typically for dental, at least in our area, it's just going to be straight fee-for-service Medi-Cal. It's different than the managed healthcare plans. There are a few areas. So Sacramento and LA does managed care for dental as well. So if a consumer came from those areas, they may still have it. And I am not as familiar with those. But typically it's just fee-for-service Medi-Cal.
Okay, thank you.
So if it's, that's not a lot of help, because if you did have something specific, I don't know, because I never come across it hardly.
Yeah, no problem. I will, I mean, that answers my question, but when I figure out the name, then I can ask you and maybe we can have a more conversation about it.
Yes, and if you do have a consumer that has that managed dental plan, sometimes it can be really hard to find them a dentist in our area because we don't do that managed dental care.
Okay. Thank you.
Mm-hmm.
Okay, thank you, Annabelle. We have a question here from Chris. On average, how long will the process take from making a referral to getting the consumer seen by an oral surgeon, being that the consumer has all of the necessary documentation?
That 100% depends on which center they're going to. At one point, right before shutdown, Dr. Begal was booked out about 8 to 12 months. Maybe 6 to 8, depending on what surgery center you go to. And then Dr. Barnes was maybe 8 weeks out. right now, every referral that I have, a lot of them are from 4 months ago that we haven't even, that I'm just now touching because of the shutdown. They weren't accepting anybody. They weren't even looking at paperwork. So that's a great question, but I don't know how to answer it right at the moment.
Okay, I will get the question on Q&A from Patricia, and then I saw Joel has a question. So from Patricia, what are some methods providers can use to desensitize teeth?
Desensitize the actual tooth. If the person has sensitive teeth, they could do local anesthesia. They can do a numbing gel. A lot of times a dentist will recommend fluoride varnishes to help the teeth be less sensitive, if that's the question. If the question is how do you desensitize the patient, it takes just a lot of patience and time, which typically regular general dental offices do not have the time and the finances to do those free behavioral appointments.
Okay, and then Joel has a question.
Thank you, Carissa, for taking our questions and for helping us with this stuff.
Yeah, of
I
course.
ran into a really strange, very long run out situation with Dr. Bagao where they wanted records from his dentist saying that they couldn't treat him there, and hence his need for Dr. Bagao. But the dental provider that he had went to wouldn't release any records, couldn't provide a statement. And so we probably spent maybe between a month or two going around and around with her going to her dentist in person, trying to get the information for her young adult son. Is there a better way? What exactly is needed for Dr. Bagao's office to qualify someone as not being able to see a typical dentist?
Right. So if that dentist would have been easier to work with and they would have just written a referral, you know, I am so-and-so and this consumer so-and-so has, you know, X, Y, and Z diagnosis or X, Y, and Z behaviors, that would have sufficed. But if the dentist is not willing to work with us, I wouldn't say the easiest route because it's not going to be easy, but the best route would be to go to the medical provider. Typically, our consumers have a medical provider who knows them, or at least, you know, has their records and has seen them before, and can attest to the fact that they have whatever diagnosis they have, and can attest to whatever behaviors they have. And so if that medical provider can release a referral stating the diagnosis or the behaviors, that typically is sufficient.
That's awesome. Thank you.
Mm-hmm.
I'm not sure if everybody's able to see the chat. So I wrote there, if you have any questions that you want to ask verbally, you may use the raise your hand function, and then I can allow you to talk. So, or you could use the chat and or the Q&A button. Any other questions for Carissa? I'm not seeing any so far. So if there's none, I would like to thank you all for attending our dental update. Please feel free to check out the website for the other dental classes that Carissa has had and upcoming classes. Once we are done, usually Zoom gives me a link of the recording. And when I get that, I will post that to our Inside Exchange. So you guys will have access, or tell your other team members who haven't been able to attend and wants to listen to what we have discussed today. They'll be able to have access to that. Thank you all for coming. I appreciate you. And stay safe.
Thank you. Yes.
Carissa, and thank you, Tony.
Yes, thank you guys for having me. I really appreciate it.
Thank you.
Okay, bye.